So here's the map essentially of what we want to talk about today, and the map of how we think about project planning and implementation. So we always start with the outcomes. What is the change in the world we are trying to create with a project or initiative? And we want to understand that in a way that's very clear about the population or beneficiaries or participants that are the center of that change. It might be a change in an environment or situation or context. It might be a change in a household or in a system or structure. Whatever it is, we want to make sure we understand that really well, and that's driving all of our strategies and choices, and sort of that touchstone that we always come back to when project planning, et cetera. We then want to also understand how we create goals around that can be really used over time. They're not sort of just sitting on paper or chatter, but they are something that are really meaningful and can be measured over time. How we decide what deliverables are important for the project to succeed, and then milestones we know we're going to hit along the way. So we're not getting to the end of a project period and thinking, how did we do? But we have that built-in infrastructure to understand our progress as we go. Then we'll talk about some of the tactical work. So how are we putting a work plan in place? And what does that look like? What kind of templates might we use there? How are stakeholders being engaged? We know that equitable and inclusive work has a different relationship with stakeholders than other types of projects or work. And so we want to be really intentional about what stakeholder engagement looks like when we're designing. So as part of the process, as part of the outcomes, and importantly, within the decision-making matrix. And then finally, what does execution look like? What kind of tools are we using in an ongoing way? How do we kind of stay true to what we said we would accomplish, while also remaining nimble enough to adjust as we go? So we're going to go through each of these segments, and for every one, there will be a little worksheet or work exercise that we'll do kind of quietly on our own, and then come back with questions or thoughts about how the tools are working. So let's start at the beginning, overall outcomes and how we think about that in a project context. So for every sort of initiative or organization, there is almost always a really strong understanding of the change that you are there to create. What is the North Star, the overall work for? It's why. And that can be a little bit different when we think about collaboratives. So an individual organization will typically have a well-articulated mission, have a really good understanding of the strategies or the what of its work, and how that might tie to overall outcomes for populations, neighborhoods, people. Then there is often some kind of collective grant or initiative or organizing structure that includes multiple organizations. And we want to think about how those two things feed each other. So what role is my organization playing inside the overall outcomes of what's being accomplished? And how do I design my project plan with that in mind? And so we'll do one example. This is a project that is focused on statewide approaches to building mental health capacity inside public schools. And if you look, you see that the overall collective impact effort, which involves about 6 leading organizations and then countless additional stakeholders and organizations, the goal is to help schools put systems of support in place, internal planning, conducting assessments, putting action plans in place, ensuring you're staffed to support student mental health, et cetera. So how are we thinking about that from a systems level so that schools end up being trauma responsive and healing centered in their policies and their practices? So that's the collective or the collaborations overall focus. Then we think about this partner. What role do they play? This one of 6 partner. And their mission is to help the vulnerable and hurt in our communities. That's their language. to heal from adversity, traumatic stress, and suffering they might experience during childhood. And what do? They provide and disseminate state-of-the-art trauma-informed and trauma-focused evidence-based practices. And then overall, between those efforts, the effort of this single organization and then the 6 or 7 other entities in the collaboration, these are the adults that we want to see, or the outcomes we want to see, that adults and schools are increasing knowledge and understanding, building best practices, that high percentages of the staff in the school are engaged, et cetera. You can see how those things start to tie together. And so we're going to workshop this same question. What are the impact areas of the collective impact effort? And what is my own organization's mission and strategy? As we do that, I want you to think about a couple of things. So you can see here that there is an outcome orientation in the collective impact effort. And the outcome or the change we want to see is that student mental health and resilience grows. Similarly, the partner organization has articulated an impact or a change that they want to see, which includes healing from adversity, traumatic stress, and suffering during childhood specifically. So they're not the same, but they're very closely aligned. Then let's talk about how that outcome is achieved. Within the collective impact effort, it is achieved through a school. So the collective impact group has decided the school is the leading unit of change. That is where the work will happen. And how does the partner organization do that work in a school? They provide training and knowledge to schools around trauma-informed practices and healing-centered approaches. And so they are a key provider in instigating that change within the school. And together, when that organization is doing that work in tandem with the series of other organizations focused on the same outcomes, we start to see these results. So try, as you're doing your own workshop, to think about those elements, the outcome alignment, the overall work and the change that it's trying to create. And then what is my role as an organization in bringing that to life? I think we do ask you to focus on a specific piece of work or project, because as we go through this session, we'll kind of keep designing some of that project plan using the same concept, building on itself. So for those of you who have already opened the workbook, I'll walk you through in a minute where you can find this. But you can see that we've included the Building Healthier Communities goals. These are highly outcome oriented. So they tie to lessening the spread of and the impact of COVID-19, of the pandemic. And there's some really concrete ways that happens. So it's about access to resources. It's about expanded capacity, eliminating or removing barriers, outreach and education, and then thinking specifically about racial and health equity work. And so I'm going to ask you now to think about your mission, the outcomes that your organization is in place to address, and then just call out specifically how is my work or my project aligning to that collective impact effort. For those of you who have joined since we began, I'm putting a link to the workbook. So you can go ahead and click that link, open it up, draw from the file menu and make your own copy. And then that will be something you'll use for the rest of this session. If you scroll down to page 3, I think it is, you'll see these questions, these prompts, your mission, your outcome areas, and your natural alignment. We'll take 5 minutes, go ahead and just come off camera and spend a little bit of time in reflection and fill out the workbook, those 3 questions in your workbook. I'll be here, put questions in the chat, but for now, go ahead and get started and we'll go until about 3. And just feel free to put questions in the chat if you have them, or if you have any technical difficulties. Take 2 more minutes.
Our interpreter has arrived now, and so they will be joining. Irma will be joining.
Yes, I can hear you.
So while folks are finishing up their exercise, I just want to ask my colleagues, do we need to give instructions around an interpretation channel or anything else in order to be well set up?
Yeah, yes. Can you all hear me?
Yes.
Okay. Thank you. Thank you for your patience. For those of you all who need the interpreter services. So at the bottom of your screen, there should be a globe icon that you can click, and it will give you a drop down to be able to listen in to the session in Spanish. And you click that, and then you should be able to be in the room and hear the interpreter. Please feel free to continue to message me or Lori if you all need any other further assistance. Thank you.
¿Lo puedo repetir en español? Can I repeat it in Spanish?
Please.
So ya está disponible el servicio de interpretación. Solo tendrían que apretar el globito que aparece en la parte de abajo de la pantalla y seleccionar español para que puedan escuchar. Gracias. Thank you, everyone.
Wonderful. Okay. Okay, so I think we are coming to the end of the time we had set up for this exercise. Let me just ask in the chat, can you weigh in and let us know how easy or hard was it to draw the connections across these two areas of focus? I would also love to hear what kinds of outcomes did you outline in the exercise? So if you could just let us know in chat, we'd love to hear more about how that went. I'm just putting the questions in. How easy or hard was it? And what are some examples of outcomes that you captured?